Hello, everyone. This is Raj, Doctor of Physical Therapy, and welcome to Senior Citizen Wellbeing Group live. We are recording this before the live so that we can um, take the comments and answer the comments if possible. So today we are going to talk about gout, frozen shoulder, spinal traction, general, neuropathy or nerve-related issues, and also general well-being for senior citizens. These are the questions that came up in the Senior Citizen Wellbeing Facebook group. People responded. Thank you, everyone, for giving us the topics to discuss about. And today we have Dr. Ryan Perron is also with me today.
Mhm.
Hey, Ryan.
Good morning.
Good morning. And the first topic we are going to talk is gout, gouty arthritis. Especially in seniors, we hear this a lot about severe, sharp shooting pain, like, it's like pins and needles. Especially, most people complain of big toe, the
hmm
joint in the big toe.
Yeah.
Can you please talk about gout? Your experience treating patients with gout?
Well, studies find that most people that have them are males for the majority. And like you said, they're in the big toe. A lot of the gout attacks, they can come and go. Sometimes they last about a week or two. As a physical therapist, we don't encourage people to exercise or do anything vigorous during gout attacks because what causes the attack is the uric acid that your body produces, and sometimes you have too much of it. And we'll talk about some of that too in a bit. But there's a crystallized formation that happens, and then when they get into the joints, because the kidneys can't get rid of it, then that crystallized formation in the joints is what causes all that pain. And so, knowing that that's causing the pain, then we don't want to, really be moving that joint around a whole lot. So, some of the risk factors that can contribute to gout that maybe people can kind of have a little bit of control over is being overweight, eating certain kind of foods, a lot of animal proteins, animal flesh, shellfish, foods that contain meat can, so if that's a big staple in your diet and having obesity, those are some things that can be more controllable factors.
Right.
And
I
yes,
do see that, beer, alcohol
hmm
beverages, or even soft drinks, if you drink too much of
right, yeah,
fructose, content, including Coke, Pepsi, all these soft drinks, as you said, shrimp, lobster, seafoods,
yeah,
shrimp, lobsters, mussels. Yeah, those are the highly, I believe, they produce. My understanding is the purine is a chemical that is present in these foods. So our bodies can process them. That's why the patients that have gout usually use the medication called allopurinol.
yeah, yeah,
Allopurinol, or yeah. So hopefully I'm pronouncing it right. So the
yeah, yeah,
allopurinol,
hmm
it clears the uric acid crystals out of the body. That helps decrease the pain.
yeah.
Uh,
Yeah, yeah, and those are, some of those, dieting, the diet that we have. Those are some things we can control and kind of, see are more manageable, to
right.
do, and they can be preventative,
Yeah, I think preventative is the best treatment. Looks like,
hmm
the food, how our bodies are unable to process this,
Right, right.
purine, the chemical. So if you avoid it, I know it's hard. You may have to do some sacrifices on foods, If you
Hmm.
are a seafood
But
lover,
yeah, I wouldn't say you have to avoid them completely. Just if you enjoy it in
moderation.
moderation. Yeah,
Yep, you're
maybe
right.
maybe have a beer if you want after a good exercise or something. You know what I mean? If you enjoy it, make it something more enjoyable from as a reward or something. You know what I mean?
Yeah,
Just finding ways to help better manage the diet.
right. For general I mean, for pain management, I see people using Epsom salt. They rub so many types of topical creams on the foot, and also ice is a natural anesthetic. So if you can dip your feet in ice cold water, that may be, it makes your
Yeah,
feet numb.
kind of an
That way,
anti-inflammatory and.
yep, anti-inflammatory.
Hmm.
So that will help decrease the inflammation and help with pain. Those are the few things. I don't really think we have anything particularly for physical therapy other than pain management. Um, Moderate exercise. You shouldn't, when you're hurting, you shouldn't
Right.
exercise, obviously. Especially these are, I don't know. I looked it up on Google. Like, what is uric acid crystal in the joints? You should look it up on Google if you haven't already. These are really sharp, pointing,
Yeah.
crystals. They're like
Like
pins,
fiberglass or something. They
fiberglass.
kind
I
of,
mean,
yeah.
crazy how sharp they are, and they're poking on the sensory nerve endings in the joints. So that's what hurts
Yeah.
people,
Yeah.
severe pain. So
Hmm.
anything more you want to talk about the gout, Ryan?
There's also, I mean, chances are sometimes the folks like that have congestive heart failure, they're on diuretics. They can be more of a risk for getting gout too.
Oh,
Yeah, medications though that are helpful though, like over the counter, non-steroid anti-inflammatories like ibuprofen. Those are the things that can help relieve some of the swelling from those gout attacks. But however, like with all medications, there are side effects of them. Colchicine, that's another medication, but that needs to be a prescription from your doctor. Corticosteroids. Um, so one of the things is we don't want to come here and say, oh, if you have these signs and symptoms, this is what you have. It needs to be diagnosed by your medical doctor. And then some of these medications that can be given are most part are prescribed. And then as far as, over the counter, like I said, would be ibuprofen to help reduce the swelling and that. There is the one medication, colchicine. They said it's more effective if you can take it within 24 hours. So if you have a history of it, maybe if something's coming on, you can take that medication within the 24 hours to help during that gout attack. But yeah, like I said, during gout attacks with physical therapy, it's just more of a pain management. Um, Decrease your activity on that joint so it doesn't, yeah, because sometimes we think, oh, yeah, if we move it, it's better, it's going to help. But in this situation, you kind of want to let it run its course through the 1 or 2 weeks without really being vigorous on the joint.
right. Okay, great. Thank you so much, Ryan, for the information. And the next question was a frozen shoulder. One of the members of the senior citizen well-being group asked about frozen shoulder. I think Swati and I did a video on the not just frozen shoulder, but there are other topics in that video. We did it three weeks ago, so they can go to the other previous videos and look for frozen shoulder. But the mainly the frozen shoulder is nothing but the capsule in the shoulder tightens up. It freezes, kind of like, that's why they call it
Hmm.
frozen shoulder. And you won't be able to perform the full range of motion. So you'll be still able to move, but within the 90-degree range. About, I can't show. So probably this much you can go, but anything above you won't be able to go because of the severe pain. And this is very common. I mean, not every patient with diabetes gets it, but risk factor is
Mm-hmm.
diabetes. If you have
Mm-hmm.
diabetes, you are likely to get frozen shoulder. Not necessary that you'll get it, but I've seen a lot of patients with a frozen shoulder that have diabetes.
Yeah.
So, anything you want to mention about frozen shoulder? Um,
Well, it appears that they just kind of have to run a course. It
exactly.
seems like after a while they finally let up. But
Hmm.
I think in the meantime, it's best not to just wait it out. The range of motions and other physical activities that you're able to do.
Right.
And yeah, so like the physical
And
therapy, the heat, warmth and heat can kind of help loosen things up a bit to give it a little bit better motion back. But
right. So I've seen several frozen shoulder patients with frozen shoulder, and my course of action, when they come to me, my goal will be, obviously it's a tightening. So I want to work on releasing the tightness by
hmm
performing some gentle stretches. Um, anything, I won't go into pain range. I go to a discomfort range and hold it there for
yeah,
about 30
yeah.
seconds. So I do that passively. I won't have the patient do it when I'm doing it, because I want to feel how tight it is.
Yeah.
And sometimes I do some gentle traction in the shoulder joint so that I can
hmm
reach a little further
Yeah,
up,
yeah. Kind of loosening the capsule somewhat.
loosening
Yeah.
the capsule, but
hmm
that doesn't mean capsule will loosen right away. So
No.
they may get a little range when I do,
hmm
but it goes back to its tightened position.
Yeah.
So I see them several times a week, 2 to 3 times a week, based on their pain or tightness. I see them for a period of 6 to 8 weeks, and they do. How much improvement they make is based on individual patients' symptoms and their chronic nature of the condition. But a lot of people get relief. I had a patient a few weeks ago. He was a young guy, but he with a diabetes. He was in mid 40s, and I treated him 4 days, 4 different, couple of weeks for 4 days, and he relieved
Yes,
within two
really.
weeks. He's like, he's able to lift higher, and but he's still weak, based on age, chronic nature of the shoulder,
hmm
um, the symptoms. So yeah, so you have to go to a physical therapist to understand the condition and get proper treatment. A lot of people, I mean, if they don't go to a physical therapist, what ends up happening is they don't move their shoulder much. They
Right.
don't
Yeah.
limit
Yeah.
themselves. That results in weakness of the shoulder. The pain gets worse. They won't be able to do a lot more functions
hmm
after the pain
Yeah. Yeah.
decreased, because
hmm
they
Yeah.
they didn't
They
do
they
anything for weeks
Right.
together.
Yeah, they kind of didn't prepare themselves for when it did finally release, and then now what? And
Yep,
then they have a chronic
chronic.
situation,
Yep.
condition.
Yeah. So I would highly recommend, if anybody has a frozen shoulder or any severe pain in the shoulder joint, you must see a physical therapist to um, get guidance on how to understand the condition, how to progress
hmm
gradually, rather than doing nothing until the whole pain subsides and realizing that you're weak in the shoulder because you didn't do anything for months. So
Yep, yep. And it does take a while. Yeah, it does
it
take a
does take
couple of
a,
months, and
yeah, yeah,
for the most part.
correct, yeah. And the next topic is somebody was asking about spinal traction. So, spinal traction, mainly you see the traction in the neck or back, cervical or lumbar spine traction. Those are the
Mm-hmm.
two common ones. Um, and there are so many devices that are available. In the therapy setting, there are traction devices. You can, it is fixed to a table and you lie on it. You're
Mm-hmm.
strapped with the braces and harnesses, two harnesses, one up at the chest, one at
Yeah. Mm-hmm.
the pelvic area, and does the traction. That's one common thing.
Mm-hmm.
But in United States, I have experience working in India as a physical therapist for a short time. Um, yeah, I did my internships and I worked for less than a year. But the we I saw wherever I went to in internships, I saw traction table everywhere. But in United States, I don't think I've seen a traction table.
Oh yeah,
uh,
yeah.
yeah, because
I
it's
remember seeing a couple of them. I mean,
you
they were
did.
old. Yeah, they were old though. But
Right.
yeah,
It's
I
not
think.
common to, get a traction device in a clinic in United States. I think I've done internships in multiple clinics as we do,
Mm-hmm.
as a part of the course, and I worked in different settings. I've never done a traction. I did traction manually myself. Um, I've done it for lower back pain. It does relieve pain. I experienced it on myself in India on the traction device, as well as somebody pulling my, doing the traction
Mm-hmm.
manually, and it does feel relief, the pain relief, especially if you have low back pain, or neck pain. You can re- feel relief because traction is, let's say these are the spinal vertebrae, and when you use the traction, the gap between the vertebrae increases,
Mm-hmm.
so that releases the nerve. That there are nerves coming out from between these vertebrae. uh, I'll just show this way. So the nerve, the pain,
Mm-hmm.
consider the pen as the nerve coming out. So when the vertebrae is separated, the the pressure from the nerve is relieved. That's what causes the pain relief in,
Mm-hmm.
especially if people with sciatica. If it is a
Mm-hmm.
root cause, that's where the problem is.
Right. Right.
And such conditions, the traction really helps. even Even if you don't have nerve pain, like how we tend to stretch when we are really tired, and if we feel like stretching out this way, it feels good when even when you generally stretch, because we tend to get into bad postures throughout the day. As you work, you're very focused on work and get into bad positions, and when you stretch, you feel relieved. It's
Mm-hmm.
exactly the same, but it's very temporary. Traction is good, but I don't think there is a significant evidence for, I don't know if there are so many researches, the studies on traction. And it's a subjective feel. Like,
Mm-hmm.
you can get the traction and relieve some pain, but you're not really doing any treatment. it's a it's
Yeah.
just a symptom relief,
Yeah. It's a temporary
temporary,
moment, only in that position, and you
because you're
can't.
not
Mhm.
fixing that separated position, unless
Right.
you go for surgery and put you know
Yeah.
replace the discs, or
Yeah.
they put some prosthetics
Mm-hmm.
between the vertebrae to increase the gap.
Yeah, and the unfortunate thing about the pain that we get, it debilitates the rest of the day. You can't
That's
do
right.
anything. And so, I mean, it's kind of an inconvenience then just to go to a place that has a traction machine and then, get some relief, and then you're back at, being where you started with the pain. But
Yeah.
I think, from a physical therapy point of view, like there's stuff in the home, if you're able to get down on the floor and put your feet up on the couch, that is a minor decompression happening in your
Exactly.
back. So that could be a temporary relief, that you might do kind of maybe here and there throughout the day, just to kind of give your back a little bit of a break to help manage
Right.
the day. And then there's even exercises that you can do, to keep your back muscles from getting weak while you're in that position. Just kind of tightening those muscles, and then that way, if you're at it to try to relieve some of the pain, you can also be at it at the same time to help strengthen, your back muscles, and just rolling your shoulders back as you're laying down on the floor, and then push your head back into the floor as you're doing that for a few seconds. And being cautious when you start anything new. You don't want to contract 100%. You can control it. You can just kind of ease your head back for maybe 30% effort, and just see where's the manageable intensity level, and then you can just start building up that tolerance. And but like Raj was saying, all that won't change, the physical condition, the back, but we can still control and manage to strengthen those muscles and help you get, make it where it's more feasible to get through the day.
Yeah. Yeah. So it's not a treatment. It is a temporary treatment, but it's not a fix
Hmm.
to any pain, because the you're not working on anything that is going to keep the vertebrae separated. So the main thing to work on is, as Ryan was saying, strength training. While in that position, strength training, you're strengthening all the muscles around the spine. So hopefully, in a lot of cases it does help, but in some cases it may not, because of the
Yeah.
severity of the degeneration in the joints, this spinal joints. So when you strengthen these muscles, hopefully they're going to stabilize your neck and share some of the weight of your head or the torso, um, to decrease the pain in the joint, because there's not
Hmm.
as much compression, because the muscles are strong and they're holding the weight of the head and torso, if you're considering low back pain. Um, so there was somebody was that was asking about spinal stenosis. I think we covered it in previous videos. So I think that's a good, please go to the previous videos and look for spinal stenosis. And in especially this time, several comments about well-being, general well-being, living independently, seniors living independently, um, and widowed. Especially as we are aging, more and more people are living longer,
Hmm.
and women live longer than men in general. That's the statistics. Women widowed, especially they're in 90s, 80s, and 90s, probably their husbands passed away, and they are mentioning, I think there were at least two of the comments about widowed, still living independently, struggling to pay for the rent and finances. What are some resources for elderly people that are independent, not depending on anyone? Not some people stay with families. Not everybody has that opportunity, or they still want to be independent, which is great. And what resources are there, Ryan? Do you know any resources for elderly living independently?
Yeah. Well, I know there's the one that's used a lot is the Meals on Wheels
Yeah.
here, that, in the United States, it's a free service. Of course, there's some qualifications, before you're getting on those services. There is other services where there's like a community, senior citizens, get together and stuff. I think that's a great place to start
Right.
because they have a lot of information there,
That's
and
right.
sometimes with a doctor, talking with them, medical social workers, they're a great resource
And
on those things. Senior citizen well-being, I think, is
right,
a great one
council on
here too.
aging. That's right. Yeah, go to this
Yeah.
seniorcitizenwellbeing.com. We are trying to include more resources there, but we will continue to work on that goal to include resources. But there's if you're living in the United States, there is a
Mhm.
National Council on Aging website. You
That's right.
can
Yeah.
go to that website and get a lot of information. And also in each state, in each county, I believe there is a Council on Aging office. So you can go, you can look it up on Google. What is your local Council on Aging office, and call them up and ask them some information. They'll be happy to give you, you or your loved ones the information needed, and they can come. Even they do evaluations of each families and see what their needs are, and some of them qualify for financial benefits, some of them qualify for food benefits and transportation. There are so many benefits that I I have seen my patients use. Some of the services pay for electricity, some of them pay for rent, but
Mhm.
these are all, they need to be qualified. You need to show them that you can't afford to pay for this. So then the government, or the Council on Aging, or whatever the financial group that is, can take your responsibility. So
Mhm.
yeah, if you Google Council on Aging, you should be able to get local offices, or even calling National Council on Aging. They will be able to give you information. Or if you have more questions, you post it and we will look it up and help you
Yeah.
answer that question.
Mhm.
So all right. Thank you very much, Ryan, for your time. And thanks, everyone, for um, encouraging us to make more videos. Every week, we are doing one live video every week. And that's the time available for Ryan and myself. So we will try to produce more information that is relevant to senior citizens. Our focus is senior citizens. So if you have any questions, please post in comments, and comment where you're watching from. It will be great to know what part of the world you are in, so that we can also try to get more relevant information related to your country, or where you're living. So please keep commenting, liking, and subscribe if you're watching on YouTube. Thank you so much. We appreciate your support.
Okay. Thank you.
Yeah. Bye bye.